Hello, good afternoon. Welcome to this week's staff brief. I'm Paul Robinson. I'm the Chief Executive at Sherwood. And with me, I have Helena Clements, a consultant paediatrician, I'm sure well known to everyone, and known also to everyone in our our clinical lead for climate action. I've also joined by John Overton, our Discharge team leader, who's going to share with us the exciting news of the Discharge hub, which begins tomorrow. Before that, I'll cover some general updates. Firstly, on mask wearing. So we often get questions on staff brief about decisions we're taking around and the continuation of wearing masks. And we continue to do that in all indoor areas across the trust until further notice to protect ourselves and indeed others. And we're seeing an increase in the number of COVID-19 cases within the trust and indeed across the region over the last few weeks, and we've continued to experience outbreaks on site. And investigations into those outbreaks have found that some visitors have come into our premises having had COVID or with COVID symptoms. And in some cases, this has resulted in most or all occupants in a bay actually testing positive for COVID. So you can see how important it is. Therefore, it remains really important to encourage visitors to wear a mask wherever that's clinically appropriate, of course, and especially when they're moving around our hospitals. And I know some people are quite resistant to this. Masks aren't required on anything other than NHS premises at the moment. So if you experience any aggression or abuse when requesting visitors to wear a mask, then please escalate this to your manager in line with the Trust's violence and aggression at work guidance. So thank you for continuing to protect yourself and each other's in that way. Next up, so there'll be a Team Newark briefing on Friday. So the Team Newark briefing session will be at 4 o'clock on Monday. So on Monday, the 24th of October, there will be a briefing session for the Team Newark at 4 p.m. and that will be led by David Ainsworth, our Director of Strategy and Partnerships, and it will also feature Rob Simcox, our Director of People. It's open to everyone. You don't have to work at Newark. In fact, I encourage you, if you don't work at Newark, to also attend. The focus of this session will be outpatients at Newark. And the reason that we'd like attendance from across our trust is that there's many who would benefit, I feel, from finding out about services that are provided at Newark. And so you can encourage patients to ask for Newark at the point of any contact. This meeting will take place in the boardroom on Monday, as I've mentioned, at 4 o'clock. The boardroom at Newark, or you can join via Teams, and the link to join the Teams part of it will be shared in this week's bulletin. Little update on staff survey, if I may. So thank you to all who've completed your staff survey so far. I think that's about 17% of the whole trust, so that's a good start. Each week we're focusing on just one division and sharing with you the teams within that division with the highest completion rate and the most improved submission rate during the week. So the focus over the last week has been the corporate division, and the corporate teams with the highest completion rates so far are recruitment and communications, and the most improved team was procurement. So well done to all three teams. And this week's divisional focus is on surgery, anaesthetics and critical care. And next week I'll obviously share the best teams with you on staff brief. So just a reminder, please complete your staff survey when you've got 10 to 15 minutes. Your voice really matters. It was the way we find out what you think about your experience of working and contributing on our sites, and all your answers are completely anonymous, and we really need to learn from you about what's working well and how we can make things better. We talked about face masks earlier as protection. Of course, vaccinations are another important line in our defence. So we're currently delivering both flu and COVID booster vaccinations within the trust, really encouraging you to help keep yourself and others protected by getting both vaccinations. So colleagues can receive flu vaccinations tomorrow here at Kingsmill in the KTC main walkway, and that's between 9:30 and 12:30. And a full list of clinics should be on your screen right now. So that's where you can receive flu vaccinations over the next month. You can also book appointments via the intranet page. There's also the vaccination hub here on site at Kingsmill Hospital, where you can receive COVID boosters. You can drop in or you can book appointments on the intranet site. As I've just mentioned, you can actually receive both your COVID and your flu jab at the same time at the hub. I received my vaccinations both at the same time in the same arm and experienced very little as a result, a little bit of stiffness, and that was it. So I'd encourage you to consider that. And for colleagues at Newark who aren't able to access the vaccination hub here at Kingsmill, your peer vaccinators are based on Minster Ward. This week is Infection Prevention Control Week, and we'll be spreading the importance of hand hygiene and the overuse of gloves. And hand hygiene, this is about protection again, of course. Hand hygiene is the most effective way to break the chain of infection and reduce healthcare associated infections. And the IPC team will be out and about throughout the week with plenty of freebies and advice and guidance. And they are on level 2 at Kingsmill today. Tomorrow they're on level 3, Thursday on level 4. And you know what? At the end of the week on Friday, they'll be on level 5. So look out for them and access their freebies. Another freebie that's coming your way is the George Cross. I'm proudly wearing my pin badge, and you'll recall that the NHS was awarded the George Cross for its work during COVID. In August, we asked you whether you felt that a pin badge to celebrate and mark that would be something that would be important to you, and a large number of you told us that it would be important, and they're here on site, as you can see. So we've completed delivery. There'll be some logistics that are difficult in terms of distribution, so not everyone's got one at the same time, so please bear with us, but everyone can access and take delivery of a badge and wear it proudly, whether you're a full-time, fixed term, bank contract, student placement. If you work and contribute here at Sherwood Forest, then please take a badge if you would like. If you're an area team leader, line manager, if you would like to ensure that your team receives a badge, then please email Vicky Mailia. So vicky.mailia@nhs.net. Thank you to each and every one of the amazing teams who led us through the COVID pandemic. This is a testament to you guys, and testament to the NHS that was really gratefully received from the Queen last year. So last in by way of my updates is World Menopause Day, and that is today, and I was really proud to kick off and open the event this morning. We're showing our support for colleagues who might be facing challenges through the menopause, and we understand that menopause can affect friends and family experiencing symptoms, and would like anyone to join on the session that is just concluding. And for those who haven't been able to join the session, then the team will be in the Education Centre at Kingsmill and the boardroom at Newark from 1 o'clock until 4 o'clock if you would like to learn more. Okay. That ends my updates. I've already got a question. I was about to encourage everyone to add questions as you think that you need to place them in the chat. We've already got one about the IPC Roadshow coming to Newark. I'm not sure about when that is. We'll try and find out and put that in the bulletin that goes out later this week. Okay, so that ends my updates. So Helena, you're the climate action, or the clinical lead for climate action, and you're going to update us on National Recycling Week, which I understand is this week.
Yes, it is indeed, Paul. Yes, thank you. So it is National Recycling Week, and we're We've struggled to get everything into a week, and for a number of reasons, we've planned actually to do it over 2 or 3 weeks, to try and get resources out and information about recycling. And I think the most exciting bit is actually the week beginning the 1st, the 1st of November, it's a Tuesday actually, when we're going to launch our walking aids recycling. And this just seems such a no-brainer, doesn't it? So all of those Zimmer frames and crutches and walking sticks that get handed out from clinics and ED, many of them just end up in landfill or broken or in people's wardrobes. I had a pair of crutches in my wardrobe for quite a long time before I managed to, you know, get it together and bring them back. But actually, there's now a whole national work on this, and Debs Kerry, one of our senior physiotherapists, has really picked this up and run with it and is launching a return and recycling scheme, which is really exciting. And, you know, not only does it prevent waste, it prevents us falling over crutches in our house when we don't need them, and it reduces cost because we can recycle rather than having to purchase new ones. So everybody wins, and that's really exciting. So that will be on the 1st of November. And I think is going to be key. And I'd really like to see how we measure that progress over time, so we can update you how successful that's been. So we are going to be focusing over the next couple of weeks. And as a doctor, I didn't used to think very much about waste and recycling. But since I've been the climate action lead, I've sort of become a lot more nosy, and I've had quite a lot of time in the FM yards looking at the number and the different bins there are and things like that. And that's been very interesting. And I think the thing that I found most upsetting about that was the amount of medicines that get recycled and not recycled, disposed of. So I'm very keen that we minimise recycling, and that mantra, reduce, reuse, repair and recycle, is really important. So recycling or disposal is got to be the end of a chain where we've done everything we can before that. So I have sort of started to think about, you know, what do IT do? And we will make these into some screensavers, some information for you. But all of our IT equipment gets recycled and reused where possible. Some of it gets cleaned, swiped, whatever you call it, where the memory is taken out, but it can then be recycled to developing countries and to other needy organisations. And what I was really pleased to hear was that they also, the mending or the repairing or the updating is done in country, so that not only do they get reused, but somebody in country will be able to support those teams so that they're not you know, sort of dead before they get there, kind of thing. So that kind of stuff is really gladdens my heart. So IT are definitely doing their thing. And one of the things I always think is, why didn't we know that? So one of the things I'm going to make it our business is to make sure we do know what good stuff is happening, because it is happening behind the scenes. So MEMD, they're an amazing group of amazing team that repairs and reuses our equipment endlessly and extends those lifetimes very far beyond what you'd expect, I think. So there's an enormous amount of work that they do, and when they can't repair it anymore, they might be able to reuse it in a different environment, like in veterinary science or somewhere else, or they will then be broken down into recycling where possible. So there's a lot that goes on all the time, which is really exciting. From pharmacy, one of the things that has been a real focus from the government and from us locally is the inhalers. And the reason that they're an issue is that we need them, but the gases that are used as propellants have got quite a high carbon impact. It's not carbon, it's other gases. And we've done a lot of work with our clinicians, our respiratory doctors, GPs and pharmacists to reduce inhaler use where we can do, by actually improving people's asthma care. So if your asthma is good or your COPD is well managed, you'll probably use less inhaler, you know, the rescue inhaler. So there's a lot of work on optimizing health It's not about taking the inhalers away, it's about making people better so they don't need them as much. So that's really the focus. But if you have used an inhaler, and the MDI ones, the puffers, those can be optimally disposed of by bringing them back to a pharmacy. So we're not recycling them. That's not what's happening, but they are safely disposed of so that those gases aren't released into the atmosphere because they're very strong carbon. So I hope that makes sense. But the key point is optimizing self-care and preventative work, so that need for those rescue inhalers is less, and that's good medicine, and it's good for our environment. So that's another thing. And actually, Novo Nordisk, who make insulin pens for diabetes, have started to recycle their pens back to their factory, and they're recycling the component parts of that as well. So that's all good practice, and is great. And you know, we don't want to reduce. People need good care, but then if there are things that we dispose of afterwards, we need to do what's best that we can. And there's a lot of work going around in pharmacy and medicines management about packaging, life cycles and stuff like that. So there's loads going on, and I think there'll be more and more to report. So IT, I think those are the main things I wanted to bring out. We've got Matt Cannon is our sustainability lead, who helps with all of the things that we're doing within climate action. And Martin Payne is our waste manager with Skanska. And Martin particularly is working really hard with our Veolia, who are our waste management people, and with, you know, our ward staff, people looking at recycling and reducing before we get to the recycling where we can. So that's ongoing. I wanted to just mention, a few people have mentioned to me about paper towels. So there has been a change in the recycling bags, and I think people get very exercised about that. I think there's new stickers about to come out, and Martin and Matthew are going to talk about that next week to give you a bit more detail around waste management and recycling, the sort of nitty-gritty operational bits. But what I didn't know until I asked the question, because people have been asking me, is that paper towels are often sort of they're at the end of the supply chain. The paper that makes paper towels has often been recycled up to 7 times before it gets into a paper towel. So a lot of recycling happens, and the quality of stuff goes down and down and down till you get to your paper towel level. And at that point, actually, the fibres get very short and it's quite difficult to recycle. But household waste isn't just waste. It doesn't go into landfill, and it goes into combined heat and power plants. So when it is burnt, eventually it's producing energy and heat. So I think ours is going to Sheffield, and there's district heating, which is really good. And then the waste ash and stuff goes into road building and stuff like that. So even then it's recycled. So I think there's lots going on. I've just seen a quick question about plastic bags for medicines. Yes, it's on the list. It does take time. You know, there are reasons why we have plastic bags and we have paper bags. I'm hoping that we can move away from plastic bags to compostable plastic bags where we do need those. They cost more at the moment, but the whole direction of travel for the NHS and for all business is to go into compostable or non-carbon based disposables. So that's very much on the radar and is happening. So I hope that answers that question, and it just takes time for us to do these things. Our procurement leads are very much working within the hospital in the ICS, so Nottinghamshire, and with NHS England, to really put pressure on our suppliers to minimise the amount of waste that the NHS produces. And I think the infection control stuff, again, is near to our hearts, but we have to get that balance, and people are working on that all the time to make our masks less bad for the environment. We haven't cracked it yet, but we're working on it. Electric car chargers. This comes up every time. We are working on it. It's expensive. There isn't a quick answer for this, and you know, we're having to make balance our capital funds for things like this. So yes, it's absolutely on the list. We are going to deliver it, and I'm sorry it's taking a long time. I'll stop there, and we can pick up any questions at the end. But I think watch this space. Matt and Martin are going to come next week to talk a little bit about this, and we'll be launching the consumer walking aids recycling the week after. So you'll be hearing more from us. Thanks very much, and thanks Paul.
Thank you, Helena. Yes, I was going to just pick up at the end there that Matt and Martin will be joining us next week, and just reflecting on what you were also updating on, that actually there's some really good work already undertaken. You mentioned IT and MEMD, so I just wonder whether we can get someone from NHIS and Pete to come and talk to us maybe on just to again promote what they do, but also encourage us to prevent waste and reduce costs. I think that they're the for me, the sort of takeaways from this, you know, look for how we can do that. And I'm particularly interested in your newfound interest in refuse and where the bins are and what goes in them and out the back of the FM yard. So if anyone sees Helena wandering around, make sure she's got a high-vis jacket if she's peering into those bins. Can't see any more questions coming through for you. Oh. Yeah, there's a comment. So there's a thank you from Justin. Thanks, Helena. That's been really informative and interesting. And then Elaine Higgins says the adult diabetes team are working with the community to look at how to facilitate the recycling. This is about the insulin pens that you were mentioning. So to facilitate the recycling of the pens. So watch out for that in the future. So thank you for that, Elaine. Okay. Thank you. So before I turn to John, thanks, Helena. Before I turn to John, I've had an update from someone on the IPC roadshows. The question that someone asked was, when will the roadshows be rolled out at Newark? So there are plans for November for the IPC roadshow to be in Newark, at Mansfield Community Hospital and the Sherwood Care Home, and the dates are yet to be confirmed, that will be published very soon. So thank you for that question and that update. And then I've had a further question about intranet for the COVID boosters. Yeah, so I think the COVID boosters are booked through the national website, but you do have to click that you're choosing the Kingsmill hub, or indeed wherever you want to receive your boosters, but that's through the national site. Okay, so over to you, John. So tomorrow, Discharge Hub operates for the first time. Tell us all about that and how it's going to help our patients. Thank you.
Thank you, Paul. Thank you. So just a bit of background. So we've seen the impact that difficulties in discharging patients who are medically fit to leave our hospitals can have over recent weeks. And we know that the hospital isn't the best place for patients to remain. So I've been asked to come today just to talk about the hub, which is going to go live tomorrow. Many of you working on the wards will already be familiar with our integrated discharge team, better known as IDAT. Our new hub is an extension of their work, and we'll see partners from a range of organisations working together in the same room to make it easier and for us to work together to help medically safe to transfer patients be discharged from our hospitals as quickly as possible and as safely as possible, and with a view to go to the right place at the right time, and always going with the ethos of home first. The new hub will see colleagues from Nottinghamshire County Council, adult social care teams, and SFH colleagues from our IDAT teams as well, and therapy teams working together in the same office to help speed along those discharges as quickly as possible. The wards are already aware of some processes with the hub that we currently do, and the most significant change from tomorrow will be across the organisation will be that we are planning to discharge patients that are medically safe on the same day. This is quite challenging. Absolutely. I think the significant positive note from this is that partners will be, for the first time in a long time, all on site together. That will only facilitate discharges better, add to communication. Our current discharge to assessment is on Orion, and from tomorrow that's going to go on to Nerve Centre, so that will be visible as well for the first time. That will streamline the service for discharge as well. It's done in a way to help and facilitate discharges a lot quicker and a lot safer as well. So basically, from a ward perspective, if you continue the same process to refer patients to IDAT in the exact same way, nothing will change in that way, and then we will pick up patients and they'll be discussed in the hub on a daily basis, and then you'll be updated from a ward perspective of discharge for hopefully that day. That's the aim that we want to do, and it's just a case of keeping the predicted date of medically safe up to date and facilitating them safe discharges across the trust. So I'm hoping it's going to be really positive. It's quite an exciting time. The room's all set up, and like I say, it's a go live date tomorrow. So hopefully we'll face any challenges together.
Yeah,
Thanks,
you. John. I'm incredibly excited because I think the key to this is getting people together on site to facilitate and coordinate that home first policy that we've got, and getting that information on Nerve Centre as well, so it's open and people get real-time updates on that. I think and getting that working together as you've just described will make a really positive on our ability to discharge patients in a timely way.
Absolutely, and I think the presence of partners on site as well will have a positive impact for definitely patients and staff as well on site as well. I think talking to someone, we've learned to obviously use different like Teams and email, but I think sometimes that face-to-face it can't be replaced sometimes, so that's definitely positive.
That's fantastic news. So where will the hub be based?
So it's on level 1, and it's actually the hub A and B rooms. It's all set up.
Been set up. So now all this is falling into place, John. Yes.
And it's all set up, and all the IT has been completed, and then tomorrow all partners will come on site, and then it will start from tomorrow, and hopefully it will all go well. It will go well.
Brilliant, thank you. I'm sure it will. You did mention that communication with the IDAT team doesn't change.
No, not at all.
In terms of that referral.
Yeah, so at the moment, all patients are referred to IDAT through Nerve Centre. That process will remain exactly the same. So when wards want to refer to IDAT for a supported discharge, if they do it exactly the same way, and IDAT will pick that up and then complete a D2A, which will now be done on Nerve Centre. That will go through to the hub, and then that will be discussed at a hub level with social workers and Mansfield District Council, and then a pathway will be decided from the hub, and then obviously we will utilise Kurt's capacity who are in the community, and we'll look at any other care providers that can provide care for that day, and then we'll contact the wards. And with a patient having a medically safe for transfer status on Nerve Centre, that will indicate to us that that patient can be discharged on that day. We know that things change, patients become unwell, sometimes things happen, but we'll try and do it as real time as possible, obviously depending upon the information from Nerve Centre.
Brilliant, thank you. And Justin's really enthused the same way as we are. So Justin's put a comment in, sounds like a really positive move forward. Discharges can be complex and challenging, and having all parties on site can only help cross-service collaborative working and have a positive impact on discharges. Keep up the great work, John and team. So thanks for that, Justin, and I think we all agree there.
Thank you, Justin.
Further question about will the hub benefit Newark patients as well?
Absolutely. So in the very same way, All patients, at the moment, we have a hub call at 10 a.m. every morning. We discuss all patients that are medically safe for transfer. So in the exact same way, the patients will be discussed at hub level in the hub, regardless of where the patients are. Obviously, they've got to be medically safe for transfer to be discussed at that point. When they are discussed, a pathway will be determined. Some patients are more complex than others, absolutely, and home isn't always the option. But again, patients at Newark or any other site will be processed in the exact same way, and obviously we'll update the wards each day as well.
Brilliant, thank you. Can't see any more comments or questions coming in for you, John. I've had a further comment from Michelle on the COVID booster booking availability. So Michelle's just booked her COVID booster via the link that we posted to the national site. It does give an option to choose Kingsmill or indeed a pharmacist or a chemist nearer to you based on your postcode, and Michelle says it was very easy, so all sounds good there. Thank you for that, Michelle. Can't see any other questions in the chat, so I'll draw things to a close. Thank you, Helena. Thank you, John. Been a really interesting session. I've learnt loads. I've learnt loads, and I'm also looking forward to sharing the positives out of both of those conversations. So certainly be following up with both of you in the next month or so, just to make sure that we're reaping the benefits of what we're sowing in terms of the plans we're putting together and doing the right thing for patients and also the right thing for the environment. So I look forward to catching up with you soon. Thanks to everyone who was able to join us today, and anyone else watching on catch up. Thank you for all that you do for patients. Thank you for all you do to support each other, and I'll see you again next week. So have a good week. Goodbye.